Okay, good evening, everyone. Under patronage of Professor Wagdi Talat, the president of the Egyptian Medical Society the Egyptian Society of Medical Education, and with collaboration with the Arab Network of Interprofessional Education, I would like warmly to welcome you to our today's special session. And it is special because it is the first session in collaboration with the Arab Network, and hopefully it will be the start for a long-term collaboration. So it is a pleasure to have you all here in sharing in this important discussion about interprofessional education. I'm India Gozaid. I am an associate professor of medical education, ISME board member, and the research committee coordinator. Dr. Asma, if you can stop share, please, because we can see your screen. Thank you. So interprofessional education, as we see that many of you were interested to join this session, it is no longer an option. It's a necessity for preparing for health care professions who can work together efficiently. And we are privileged today to have two outstanding speakers. First, it's my pleasure to introduce my colleague, Professor Asma Abdel Nasser, Professor of Medical Education at South Canal University, Faculty of Medicine and Health Profession Education Center at Ibn Sina, National College for Medical Studies in Saudi Arabia. She is also a valuable ISME board member and has an extensive experience in health profession education. We are also honored to welcome Dr. Ala El-Isawi. She is an advisor to the Vice President of Health and Medical Science and head of the IPE program at Qatar University. She is also the chair for the Arab Network of Interprofessional Collaboration and the leading expert in advancing interprofessional learning across the region. Before we start, let me brief share you with the layout for today's session. So we will start with Professor Asma giving us a comprehensive guide to interprofessional education and its core principles, helping us to have a strong foundation for today's discussion. Then this will be followed by Dr. Ala El-Isawi's presentation, where she will share with us an inspiring experience of interprofessional learning passport program at Qatar University. Then we will have a space for question and answer. So if you have any question about IPE, about activities in IPE, or about the Arabic network, please hold your thoughts and you will have an opportunity to ask all the questions at the end of the session. Now, without further delay, I would like to warmly welcome Professor Asma to begin our session. Dr. Asma, the floor is with you. If you can share your screen, please.
Thank you, my dear colleague Inja Wazid. We are in Egyptian Society for Medical Education. This is the Journal Club team members under the research committee, which is headed by Dr. Inja Wazid, and we are working in Journal Club to provide every time under certain theme, and our current theme is about interprofessional education. Regarding my today's session, I will give you an overview about the comprehensive guide regarding interprofessional education, what is going on, and what is the update related to this important topic. Our session will go around certain objectives today. First one is about definitions to explain the difference between IPE, IPC, multiple professional education, uni-professional, and so on. And also we will describe the drivers and evidence base for IPE and collaborative practice. List and apply the stages of professional development regarding IPE. Explain IPE taxonomy. Describe the IPE competency framework. Design IPE learning activities. Design appropriate assessment strategies for IPE activities, plus interpret evidence linking IPE to patient and population outcomes. If we start for the key terminology in interprofessional education, and in every place, we will see that there is increasing from each terminology from to increasing collaboration and integration. We will start with uni-professional uniprofessional education, which means students from one profession, like medicine only, they are learning together, isolated from other health professions, and they have their own training, their own specific foundation. Multi-professional education, two or more professions, means nursing, like nursing with medicine, and they are learning side to side in parallel, minimum with minimum interaction, and they learn together to whatever for any whatever reason. Yani they are sitting together in one session. Interprofessional education, and this is what we are aiming to, is two or more professions learn about, with, and from each other to improve the collaboration and the quality of care. IBC is transprofessional or interprofessional collaboration. Comes in real practice. In that, in real practice, we will see that there is a professional boundaries are crossed and merged, and there is consensus worked among each other and shared knowledge among all different professions. According to the WHO, why IBE is important? IBE effective IBE strategy or effective use of IBE will enable effective collaborative practice, and this collaborative practice will lead to our strengths two important issues: a health system plus improve health outcomes. Other importance point is related to patient safety crisis, inadequate interprofessional preparation linked to medical errors and lower satisfaction among our patient and system inefficiency. Also, we have complex healthcare demands, and this healthcare demands in complex way, if we are not knowing about each profession's rules and how to deal, how to interact together, will affect the system, because we have in our healthcare system, we have aging population, chronic disease burden, and also rising care complexity, demand effective team-based and coordination among different professions. According to concrete evidence, 4 to 6 studies, IBE improved working cultures in ER, by reducing errors and enhancing the management of domestic violence and mental health care delivery. Institute of Medicine in 2013 also found that an IBE provides skills for communication, collaboration, leadership skills. Students learn with, from, and about each other, yielding better team-based care outcomes. Also, there is a triple aim of framework for IPE: better patient experience, improved population health, reduce healthcare cost, and the IPE a core strategy for achieving these three goals. Institute of Medicine also seeing that in evidence review, growing body of work showing IPE improves the learner perception plus collaborative knowledge and skills with emerging links to patient and healthcare system outcomes. Again, according to the definition, as we mentioned before, it is two or more professions or learn about, from, and with each other. So what IBE looks like? It looks like an educational approach requiring genuine interaction between students from different professions. Students exchange knowledge and change self-perception and professional identity, and this is very important point. Changes positively affect clinical practice and collaborative behaviors, because if we learn, as they say, always say that if we learn together, we can work together in the future. So the students, when they are intermerged together, and there is a collaboration and interaction during their undergraduate curriculum, they will in the future achieve interprofessional collaboration and collaborative practice, which improves the healthcare system outcomes. Also can occur in classroom simulation and clinical placement setting. So the aim of IB is the presence of interaction and the engagement among different professions of students. What IB doesn't look like: passive co-location, different professions, the same lecture hall. This is a wrong perception about IBE, that we are bringing students from different professions, sit them together in the same hall. When we knowledge transfer from one profession, yeah, for example, teachers from medicine school are giving lecture for professions, different professions, and they are saying that this is an interprofessional. Also, parallel activities with no structure, interprofessional interaction. If there is a parallel activities with different professions, and professional boundaries maintained throughout the activity. still we see that the pharmacy students not interact with physician medicine or dentistry or whatever nursing. There is no interaction. They are working in a parallel activity but with no any kind of interaction. Institute of Medicine at 2013 K Insights sees that in an IBE is not a replacement for any profession education. يعني when we say IBE, not we are meaning that to canceling all the curriculum or canceling curriculum as a whole, but the aim is a specific education strategy. In each educational strategy, we need each profession knowing their professional identity, their what is the core, what is the area of collaboration between them, and what is the curriculum activity or curriculum content that are suitable for interaction among the different professions, and what is the planned activities and how to implement these activities in a proper way to achieve the IBE strategy. The aim always that mutual trust between different professions, respect for their rules, and knowing their different professional identity and different professional rules, plus shared goals about, among each other and shared decision making for the better of healthcare outcomes and better patient safety. So, the patient, will family, will community always are integrated member of all the whole ecosystem of healthcare system. If we go with that immersion framework of IBE taxonomy, we will see that there is levels of immersion of IBE, of how to use it. From stage one, just exposure, and always it is achieving with the junior students at the early stage, early exposure stages among early years of the each profession. In stage two, and this is stage two, we are named immersion, and this is at the stage two, we go with the seniors students, and after graduation in the residency training, maybe, or maybe we can use in the hospital itself, we have mastery level of immersion. So when we go within this framework, we will find that interprofessional learning increasing, and there is increase more interaction and collaboration. An exposure level, this is, as I mentioned, for junior early years students, we are target to parallel learning experience with peers from other professions. Our outcome always to gain understanding of your own professions first and the preliminary appreciation of the other profession world point view. Plus, in methods always in these stages, we maybe use orientation, workshop between the students each other, introductory IBE seminars or IBE activities or profession-specific shadowing among the different professions. And the suggested assessment as these junior students, we can use written reflection on the first interprofessional event and how you are benefit from the other colleagues from other professions. And in that case, we can use formative type of assessment. As a stage two immersion level framework, this framework, this level or this stage can be introduced for seniors clinical year students. Our target is collaborative learning with the students from different professions. An outcome acquire an interprofessional worldview, incorporating multiple perspectives, challenging each other. We can use different educational methods or educational strategy like case studies, team-based learning, simulation, interprofessional case rounds, bedside rounds, and etc. And there is many methods can be used. And that stage we can use the assessment level can be formal IBE course case studies, also with patient or simulation, and we can use formative or summative kind of assessment. At the mastery level, which was always suggested to be used post qualification, yani mainly after graduation, we use this level at this at this stage. Our graduated students from different four professions or more, all healthcare professions, or maybe we can use other professions rather than the healthcare system. All are welcome to be introduced in the ecosystem of IBE or IBC. So in this mastery level, incorporating different interprofessional competencies into the daily professional practice in hospital. And also the outcome of this level, we advancing the critical thinking of the students, or of the graduates, high self-reflection, also deep understanding and interprofessional contribution among each other. We use the different IBE simulation with observational tools, and I will explain more about this tool. One related to the team working, and another one related to the observational team working and feedback, and another one related to communication and teamwork. And different workplace-based assessment source, the multi-source feedback, 360-degree feedback. Also, we can use reflection and the portfolio. All are effectively to be used in this stage. We can do assessment using simulation, reflection, and formal summative OSCE stations. Progression across the different stages are according throughout the curricula, and we are going from seniors, then after graduation until reaching a clinical experience. Then I will give you briefing about the IPEC core competency framework. And these core competencies for interprofessional collaboration practice framework are developed by multi-institute internationally, the American Interprofessional Healthcare Collaborative, plus the Canadian Interprofessional Healthcare Collaborative, Center for Advancement of Interprofessional Education, official publication Journal of Interprofessional Care, Health Profession Accreditors Collaboratives, Institute for Healthcare Improvement, Interprofessional Global, and by the way, in our Arab networking part of this global network. But for the Arab networking, and inshallah, Dr. Ala will give you more about this point. National Academic of Practice official publication, and National Academics of Science, Engineering, and Medicine Global Forum, National Academy for Medicine, National Center for Interprofessional Practice and Education, National Collaborative for Improving the Clinical Learning Environment, plus the World Health Organization, all are together developing this and are reaching in consensus about this framework competences, and which is always concentrating in four main competencies for interprofessional collaboration. Competency number one is related to the values and the ethics. Place patients' interest and population well-being as a center of care, respect dignity, privacy, and cultural diversity of all patients, maintain ethical conduct across different professions with integrity, act on commitment to safe, high-quality, accessible care. This is number one, related to values and ethics. Competency number two, related to the rules and responsibilities, and they are reaching to that know own scope and the professional responsibilities clearly, recognize and respect other professionals and expertise and rules, communicate rules with clarity to patient and team, use unique complementary competences of all team members. Competency number three, which is related to interprofessional communication. Choose communication tools that support your team and understanding. Express ideas confidently and yet which give floor and open environment for team perspectives and different point of view. Provide constructive feedback. Use accessible jargon-free language with patient and families. And this is regarding interprofessional communication, which is mainly part of the interprofessional collaboration, the big umbrella, because it including the patient and their family. But if we talk about interprofessional collaboration, we are concerning that professional collaboration among the team. But if we go through the communication, we will reach to include more and the big umbrella to include the community, the patient, and their family. Teams and teamwork, and this is the competency number four, which is related to apply team science principle to effective team functioning, engage diverse health professions, ensure the patient-centered problem-solving care, also lead and participate appropriately, ensure the health promotion, reflect on team performance, improve collaborative practice. So if we are aiming to develop IBE learning activities in our curriculum, we are suggesting to use different strategies like team-based learning. We're using the concept of team-based learning plus IBE to team working and the communication among many juniors years to discuss a case and see from each profession point of view how to solve this case. Also, we can use an interprofessional simulation, and maybe this is through using the simulation plus film scenario, testing team formulation or role clarity with IBE values. And we have different tools like CBOATs, which means clinical teamwork scale behavior observation assessment tools. And these tools used mainly for simulation to test the teamworking skills والcommunication والcoordination والleadership in a situation with situational awareness. Also, we can use ITOFT a tool, which is means improve. This tool is related to improve the teamwork observation and feedback tool, and this tool for testing team working on practice. Also, we can use case-based discussion, clinical cases with the analysis of both student teamwork experience and the patient experience of collaborative care can include all and peer self-assessment. Also, we have student-led IBE seminars. We can introduce IBE seminars by the students themselves by peer teaching and to evaluate the peer learning with peer teaching and the peer assessment. In that case, we are introducing the different professions students to do seminars or kind of educational campaigns among each other in a certain topic, for example, related to patient safety, like medication error, or using ethical issues, our ethical dilemmas from their professional different point of view. Also, we can use in the practice clinical placement IPAL real practice interprofessional teams engaged to for observational rounds and panel discussion together. All these activities we should be carefully align them with the curriculum learning outcomes. So we have learning outcomes in a different courses or maybe in curricular activities and inside the curriculum related to certain learning outcomes, or maybe we have activities extracurricular, but we should do certain alignment to align this activity with the intended learning outcomes we have, and we select the specific and the possible educational teaching methods and assessment methods that all are in alignment. By the beginning of each alignment, we can introduce for the students what is the importance of using this activity and what is the relevance for their profession different point of view, and how this activity will achieving the aim purpose of the IBE that we are needing all of you to learn from about and from and about and with each other. Okay, this is regarding designing different activities of IBE. If we need to use different methods of assessment, there is a different methods of assessment can be used for formative and summative. And this is example for formative assessment at the beginning. You can use it as a formative assessment for self-reflection, peer assessment, interprofessional simulation using different cases and so on. Later on in the junior levels and when they understand the concept, we can use summative assessment to test their knowledge first using exams, theoretical part, or OSCE stations with IBE focus or simulation scenarios using different tools like individual teamwork, observational, and feedback tool. Also to intermill IBE concepts with the Miller's framework, which is knows how, shows how, and does. So the IBE assessment can be spanned all over the levels of performance assessment of Miller's framework. And this is example how to use during the exposure level, which is the introductory levels in year 1, 2, maybe in 3, 3, 4, we can go down with the immersion level and mastery, and what is the suggested method of assessment can be used in each level. So our recommendations for you during the planning and during implementations. In planning recommendation, we are asking, we are see that the conclusion is to do the following. First, to start with your curriculum alignment, build an IBE assessment matrix early. Assess your capacity. How will the assessment process be managed at the scale of your curricula? With different professions, use methods acceptable across the different professions are shared together, like adaptable e-portfolio, involve student and patient from the outset in design to take the different stakeholders point of view. Also, underpin assessment with a theoretical part, Build a picture of student learning over time using formative or summative cycle, built on the milestones of using IPE in different parts of the curricular or extracurricular. Consult professional body requirement for all participating professions. In implementation, we recommend you ensure first to do a faculty development. All clinical staff or whatever staff are sharing in IBE activities should be familiarized about the concept, because sometimes the faculty themselves not familiarized about the concept. If we didn't change their mindset, how we can guaranteeing that this faculty will help us change the mindset of the student or help them to achieve the concept of IBE. Build a knowledgeable IBA assessment team with dedicated coordination, use validation tools, explore a more multi-source or whatever kind of workplace-based assessment tools, plan and consider to evaluation early during the curriculum development, and use mixed methods evaluation. And I will explain about I will give you briefly what is the Kirkpatrick model, how it is modified to go hand in hand with the IBE, commit to different competencies of IBE EC. Regarding these levels of Kirkpatrick model, they suggested by Institute of Medicine in 2015 that if we need to examine or to see the effectiveness or measure the impact of any IBE activities or IBE course included in your curricular with other professions, you can use the Kirkpatrick model. All of us are familiarized with it, but here are modified a little bit to be goes hand in hand with IBE. So we started with reaction, then level 2A with attitude and perception of different student professions, then knowledge and skills, how their knowledge and communication skills, teamwork are changed, level 2A, then level 2P. In behavior change level 3, we are observing their change in their collaborative behaviors and the practice using different tools for team working and communication. In level 4A, we can testing the practice change, and this is for the long run outcome. How come the interprofessional education and the interprofessional collaboration affecting the healthcare itself and system itself affected for better team functioning, reduce الميديكال ايرور, better ecosystem for healthcare. And the last point is level 4B, and which is related to the patient safety improvement and healthcare system mortality and cost efficiency and the population health impact, all are changing. Regarding the collaboration and publication, we did, I am author in this publication, collaboration between Suez Canal University, Faculty of Medicine, Suez Canal University, Medical Education Department, and Ibn Sina National College. We developed different stages of publication. The first one in 2018, and this is about introducing IBE course in leadership and management, and we actually introduced this course for adapting course for leadership and management for management health for science organization, and these courses are managed adapted to be delivered for house officers or internship years of medicine and nursing intern. And actually, we published this in Education and Medicine Journal in 2018. Also, in 2021, we do another trial or another study in IBE in Suez Canal University about using a short course in ethics. And this course introduced an e-learning using an e-learning concepts and ethics course about cases in ethics. And we published this article in Advances in Medical Education and Practice. We have also two trials in Ibn Sina National College, one related to readiness for interprofessional learning among students for 4 undergraduate health profession programs. And this study published in Advances in Medical Education Practice in 2023. It is to test the readiness for IBE. After this study, we are introducing 3 IBE courses completely in the curriculum. And this study started when we are reforming our curriculum in Ibn Sina National College. Then we are using 3 courses in IBE manner, one related to the ethics and professionalism, and at 2024, we evaluated this course in the last study in Frontiers in Education, and this course at that time was due to COVID-19. We adapted the course to be delivered online, accepting and applying it among the medical with dental and pharmacy. Now we are introducing nursing student also with us in this course. And we have another two courses related to safety and research methodology. We're still under publication process to improve more about the concept of IPE. We develop new ideas and new collaboration with Arab networking for IPE. So in conclusion, in my presentation, we in this comprehensive guide, we give you understanding of IPE terminology, theory, competency framework in brief. We're trying to show you how different assessment, how to see the framework, how to do learning activities in different parts of your curriculum, IPE competences, what is the importance of IPE, what the IPE looks like and don't يعني, or the different perception about it, and what is the recommendation we have for all of you to use IPE concept in the curriculum. Thank you for your listening. I'm so sorry for taking more time. Sorry.
Thank
The
you,
floor.
Dr. Asma, for this comprehensive presentation and actually very useful tools. Do you prefer to take question now or wait until the end of the session?
I think we can give floors first for Dr. Alat to present her talk, and we can collectively collect all questions by the end of the session.
Okay, and so it's time for Dr. Ala to join us and share with us her inspiring experience about using of IPE passport. So Dr. Ala, please share your screen and the floor is yours.
Thank you. Okay, can you see my slides?
Yeah, it's clear.
Okay. Assalamu alaikum, everyone. It's a pleasure to be here. Thank you so much for the invitation. And it's great, seeing people interested in interprofessional education and how to integrate it into the curricula. And thanks to Professor Asma for, the great presentation on how to integrate IPE from the early integration to the evaluation, assessment, and dissemination. So thank you all for joining. My name is Ala Alawaisi, and I'm going, so today, oops, you can't see my screen, right?
No, please
Okay.
share it.
Okay.
Yeah, take your time. We can see your screen now. If you can just present full screen. Yeah.
Okay, you can see it now.
Please.
Okay, so today I want to talk about how do we design collaboration. Professor Asma has, talked about the principles for IPE, and I'll be sharing some examples from our experience. So it's not just about teaching interprofessional education. How do we design collaboration into our curricula? I'm not talking about education reform alone. I'm going to be talking about workforce transformation. At Qatar University, we asked a simple but an uncomfortable question. Why do collaboration failure persist even when we teach teamwork? I think everybody within their own curricula, they do teach teamwork, but still, why there is no collaborative practice out there? And this answer led us to the IPE passport as a system, not just a course. Before I begin, I just wanted to briefly introduce myself through my own IPE journey, because interprofessional education has been central to both my career and my purpose. So I started in clinical pharmacy. I completed my MPharm at Strathclyde, and then I did my master's in prescribing science and a PhD in interprofessional education. And alongside this, I spent over 9 years in clinical pharmacy practice within NHS Scotland. So that clinical foundation shaped how I understood patient-centered care and the importance of working effectively across professional boundaries. Then moving to Qatar University, transitioning into academia, where education became my main tool for change. I started at the College of Pharmacy, and I had the opportunity to bridge clinical practice with teaching, leadership, and student development. A major turning point in my journey was the establishment of the Interprofessional Education Committee in 2014. And this is where really the IPE spark really started. Since then, we have worked to embed IPE more systematically, including the launch of the IPE passport in 2020. And also, later on, my IPE journey expanded beyond Qatar. So currently, I'm involved with Interprofessional.global. We founded the Arab Network for Interprofessional Collaboration. We hosted the first Middle East conference in 2015. And later, I was the chair of the 11th edition of the Altogether Better Health Conference, which was hosted in the Middle East for the first time in Qatar in 2023. So for me, IPE is not just an educational approach, it's a professional mission. It connects clinical practice, education, leadership, and global collaboration, all with one central arm, and that's preparing health professionals who can work together for better patient care. I would like to start with this patient. Let's call her Mrs. Sarah. This is a healthcare déjà vu. So Sarah comes to the nurse. She sees the nurse, and the nurse asks her, "So what seems to be the trouble today?" Then she goes to see the doctor, and the doctor tells her, "So tell me, what seems to be the trouble today?" So she's repeating her story again. Then the doctor refers her to the radiologist, and the radiologist asks her, "So what seems to be the trouble today?" And remember, when the patient is coming to the clinic or to the hospital, they're not feeling well. So she has been, repeating her story over and over again. Then she was referred to the physiotherapy clinic, and then again, the physiotherapy clinic. The physiotherapist asked her, "So what seems to be the trouble today?" And here, she said, "Oh, for goodness sake, don't these people ever talk to one another?" So each did their job well, and yet the patient is frustrated. Not because anyone was careless, but because care failed between the gap between us. So in today's presentation, I can talk about IPE for 5 minutes, I can talk for 20 minutes, or I can talk for hours. So please, Dr. Inji and Professor Asma, just let me know when I have 5 minutes to conclude my presentation. So I know Dr. Asma talked about IPE. I will be talking, starting with what IPE is not before what IPE is. And I will be sharing our IPE experience and, what challenges did we encounter, what lessons has been learned, and reflecting on how collaboration can be embedded into everyday healthcare systems. So if we think about Mrs. Sarah, it's not, the patients, Miss Sarah, didn't feel frustrated because these professionals lacked knowledge, but because we lacked system-designed collaboration. It failed between professions, between handovers, between systems. Healthcare has never been more advanced, and yet patients are still harmed in the spaces between us. So today I'm going to show you how we move from teaching collaboration to designing healthcare systems that make collaboration inevitable. We know healthcare is more complex than ever. We have more professionals, more transitions, more risk. Without intentional collaboration, complexity amplifies harm. Healthcare is becoming too complex for isolated expertise. However, if we look at how health professions is being taught, training is still profession-centric. assessment is still individual, and culture is still hierarchical and fragmented. During the COVID pandemic, I saw this image which says who society thinks works at the hospital versus who actually works at the hospital. And then there was this, long list. And, I thought actually this is very true. And I posted it on my X, it used to be called Twitter then. And I was really intrigued by the amount of people who shared my post, who commented on my post, and who were engaging with it. And I thought, wow, that's really interesting. So, and people were sharing this image. And then we decided with some colleagues in the UK, I did a content analysis of perception of who is in the healthcare team. Looking at this, analysis of these social media comments during the COVID pandemic. And if you remember at that time, some cafes were giving free coffees for doctors and nurses. And I recall, some of our pharmacy alumni were saying, but why are we not getting this free coffee? Although, it's a free coffee. But it's like the sentiment of giving free coffee is just for doctors and nurses. And when we looked at, the comments, there was that sense of frustration that media portrays healthcare team as doctors and nurses. Many felt that their jobs were overlooked. There was that sense of gratitude is, oh, thankfully, somebody has noticed this. Somebody is acknowledging that there are many professionals who are working for the safety of the patient. And that sense of relief that, there is more professions that are being recognized. And when we looked at the themes, there was that question, who is in the healthcare team? And that hospitals are run by more than just doctors and nurses. There was that, sense of agreement, but also that sense of feeling excluded. And imagine if a health professional will have that feeling of being excluded, the impact this is going to have on the way that they interact with other health professionals or on the care that they are providing for patients. Unfortunately, barriers, we must be honest about barriers to be able to move forward. We know hierarchy still shapes who speaks and who doesn't. Roles are often unclear or undervalued. Time pressure and culture quietly undermine collaboration. But I want you to take into consideration that naming barriers is not a blame, it's leadership. Also, these barriers are not individual failures. They are system design problems, and system can be redesigned. So back in 2010, the WHO, one of the key messages in the publication Framework for Action on Interprofessional Education, one of the key things or one of the key messages within it is that if we are expecting health profession students when they graduate to work together, why are there no opportunities within their education to learn with, from, and about each other? To graduate this collaborative practice health workforce, and this collaborative practice health workforce will promote this collaborative practice and will lead to optimal health services. Now, talking about interprofessional education, sometime when I'm speaking with people and you say, oh, do you have interprofessional education? And people say, oh, yes, we do. We have it in our curriculum. And I say, are you sure? And here I find that people usually, there is this misunderstanding between interprofessional education with various other things. So sometimes people assume that, let's say this is a class of students, medical student, pharmacy student, nursing student, and attending an anatomy lecture. So they're attending the same class side by side. People think, well, actually, this is interprofessional education. It's not. Or let's say in this image, we have students, medical student, attending, let's say I'm giving them a lecture on pharmacology, and people think, oh yes, it's somebody from pharmacy giving a lecture to medical student. But this is not interprofessional education. Or we have, within their clinical placement, a team of different health professionals. Everybody is talking, it's physician-led, and the physician is asking the pharmacist for their input, the nurse for their input, and so on. But there is no shared decision together. And it's just that one leader who's making all the decision. Again, this is not interprofessional collaboration. So IPE is not sitting students together or parallel teaching or one-off event. It's the learning with, from, and about each other, purposeful, outcome-driven, assessed, linked to collaborative practice. So when we do IPE activities, and these are some of the pictures of our IPE activities, we're always thinking, are the students learning with each other, from each other, and about each other? So what does an interprofessional team look like? You need to be confident in your own role to be able to contribute to team discussion, to have that shared expertise and knowledge. You're willing to share your expertise and knowledge. You understand your roles and responsibility and understand the roles and responsibility of others. Crossing traditional boundaries and empowering the different health profession. Unfortunately, in addition to hierarchy, there is also stereotype. So thinking about pharmacy, since I'm a pharmacist, sometimes if I ask, if you ask someone, what does a pharmacist do? They'll say, well, they sell medication. But we have moved beyond this. Pharmacists are now empowered, and they are the medication expert. And they're not just the one dispensing the medication, but they are working alongside the health profession team to give expertise on medication and even the system, the healthcare system. Nurses, are now prescribers. So it's moving beyond these traditional boundaries. When we first started doing IPE activities, I remember our pharmacy students would come and tell me, wow, we didn't know that nurses knew this much, because of the stereotype that they had in their mind. And a lot of these health professions, they would have spent 4, 5, 6 years not to do admin work. They are, highly talented individual. So having an interprofessional team means empowering these health professions to be able to contribute for an effective and being effective team player. And of course, understanding that no single profession can meet modern care complexity alone. So, and also one important thing is not all interprofessional work is the same. We often say teamwork, but practice is more complex than that. So really, one of the biggest mistakes we make in healthcare is assuming that all interprofessional education is the same. And there is this article that was published in the Journal of Interprofessional Care that we need to really distinguish between different types of interprofessional practice. For example, there is teamwork, there is collaboration, there is coordination, and there is networking. So the key message from this work is simple but powerful, that different clinical situations require different forms of interprofessional practice. So think interprofessional teamwork, and that's like the highest level of collaboration. Think about the ICU, the emergency response, acute deterioration. Here, where true teamwork is essential and it's non-negotiable. So in these moments, the pharmacist, the physician, the nurses, the other health professionals are not working in parallel, but they are thinking and acting together in real time. Then we have the interprofessional collaboration, and this is suited to modern complexity. So here you have the shared accountability, but less intensity than teamwork. Collaboration does not mean weaker practice. It means appropriately matched practices. So here is, for example, the daily word round, the antimicrobial stewardship. Then we have the interprofessional coordination. So here you have clear roles and handovers matter more than meetings. Think of primary care or medication reconciliation. So, it's all about that coordination between the different professionals. And then the interprofessional network. Think about community pharmacy, primary care. So professionals may never meet face-to-face, yet patient care depends on timely information sharing and professional trust across organization. So when we ask better questions, we design better system, and better system protects patients and professionals. Collaboration should never be automatic or assumed. The goal is not more teamwork. The goal is the right form of collaboration at the right time. And we must ask, these three important questions. What is the nature of the work? How urgent and complex is it? And what form of collaboration better support it? The culture, I always talk about the culture of collaboration. It's not written in policies. It's built in training environment. Students learn collaboration less from lectures and more from what they observe being rewarded or ignored. What we teach shape how people practice. Early exposure normalizes collaboration, and role modeling matters more than formal teaching. And so how do collaboration develops? I talk about that culture of collaboration. I want you to always remember that collaboration is not an event, it is an identity formation. Through repeated reinforced experiences that support psychological safety, role clarity, shared decision-making, and professional confidence in team environment. You expose them, they practice it, they reflect on it, then it's reinforced, then that professional identity, they start developing at the same time that interprofessional identity, and collaboration becomes a habit. So within Qatar University, we have 5 health colleges and 9 health profession programs. So we have the pharmacy, medicine, under health sciences, we have physiotherapy, speech and language pathology, public health, biomedical sciences, and human nutrition. Then we have dentistry and College of Nursing. So really a great environment for interprofessional education. It started back in 2009 with the development of the Qatar Interprofessional Health Council. In 2014, we established the IPEC committee. Then at the College of Pharmacy level, because we had the Canadian accreditation for the College of Pharmacy, and as part of the Canadian accreditation, we needed to show evidence that we have IPE. So accreditation was a driver for us to get started with IPE program. Then with the establishment of the health sector, which is an umbrella of all the health colleges, the committee moved from a college level to the cluster or the sector level. In 2020, we launched the IPE passport, and then in 2021, we established the IPE office. And in addition to the programs within Qatar University, we also had medical students from Weill Cornell Medicine, the University of Calgary at that time, which was for the nursing program. Then we had the College of North Atlantic. Now it's known as the University of Doha for Science and Technology. So our IPE activity are not just based on students from Qatar University, where the majority of the profession programs are, but we do include students from outside. And as part of Qatar University, the health sector, we strive to be recognized as leader in health profession education, research, clinical training, community engagement through interprofessional collaboration and partnership. So as you see, actually within our vision, we have that interprofessional collaboration clearly and explicitly spelled out. And in anything we do, we always think about the interprofessional collaboration and partnership. And this is how we integrated IPE within our curricula. Now, initially in the early days, we were thinking, do we have it as a course? All students take it, they are assessed on it. But then there was that, concept that IPE should be instilled across the different professional year and not just taught as one course. So we integrated IPE across different courses, across the different professional year, using the model of exposure, immersion, and mastery. So in the first few years, it's mostly roundtable, case discussion, then it's simulation, and now we're moving towards the simulation and IPE within a placement. So IPE is embedded across curricula and not isolated. So we design collaboration as a development continuum from student, graduate, workforce, system. So it's not an event, one single event. It's not a workshop. It's a longitudinal capability building. And of course, we need to use the IPE shared competency. And there are, Dr. Asma mentioned some of the different competencies that are out there. Initially, we were using one that was developed for Qatar context. But then later on, we felt, these are actually universal ones, so we can adopt them in the skeleton. And then, of course, the activities are implemented and integrated according to our context. So we decided to use the Interprofessional Education Collaborative. And our IPE activity, we ensure that it's in line with the IPE definition, and we are covering at least 2, 3, or 4 of these IPE shared competencies. And the IPE passport, so all health profession students are enrolled into the IPE passport program. They need to complete a minimum of 4 IPE activity across the different professional years. They submit a reflective assignment after each IPE activity to their assigned course module. Then the extracurricular activities, we also account into it the extracurricular activity, which are done through the IPE Student Association. And then they get a completion certificate letter. And actually, we give them a passport that has a stamp within it. So the passport provides structured exposure, competency mapping, longitudinal tracking, behavior development monitoring, and we're not just evaluating participation, but the identity formation and behavioral shift. So for us, the IPE passport, the mission that the slogan that we're using for it, empowered generation, integrated care, driving change. The IPE passport is not an educational tool. It's a workforce transformation system. Remember, education trains individual, but system is what shapes behavior. Also, one of the actually important things from the early days is we ensured that everything is anchored in behavioral science, workforce development models, system thinking, and that longitudinal professional identity formation. So the program that was developed was based and driven by the evidence that we collected through the research that was conducted. And these are just examples of some of the research that was done in the early days. Anyone who does IPE know that IPE is very, very challenging, but it's worth it. The good news is that these challenges are global and they're not local. But transformation is messy. People need to see the benefit before, you are able to effectively integrate it within your curricula. There was the logistical and scheduling barrier, coordination across multiple institutions, different timetables, limited shared spaces. Then, the assessment. How do we do the assessment for these? How do we make sure that these are integrated within the different health profession curricula? The faculty development training is important. If you want to have a successful IPE, it all depends on having effective facilitators. But then, faculty members are very busy. So how do we ensure that they are recognized, for the load and giving them that institutional support? And then one of the challenges is the limited interprofessional training and practice settings. We've done quite well in integrating IPE within our educational settings, but now students are out there in the practice. They're saying, well, we want to do IPE placements in our practice settings as well. And in addition to having IPE integrated within the curricula, at the same time, you must think about the extracurricular activity. So from the early days, we had the IPE Student Association, and this is when the culture moved from curriculum to identity. Students are not recipients, they are the driver of change, of cultural change. When learner leads, collaboration becomes normal, and these experiences shape future practices. So we have the IPE Student Association, and this is their Instagram and X account. And one of the activities, the extracurricular activities that they do is we have the annual IPE Student Forum. Every year, it's focused on a certain themes. We have interprofessional team challenges, we have interprofessional debates, we have talks, and it's really one of the long-awaited activities that students are always waiting. So early this year, we had one focused on autism. So seeing the person beyond the diagnosis, interprofessional teamwork in autism spectrum disorder care. In addition, they do the IPE outreach campaigns where health profession students are educating the public on a public health topic. We also had debates, especially we got this started during the during the COVID pandemic. And we debated from students from King's College London, St. Louis University in the US. So different health profession students debating, giving a motion on a topic of relevance to them. And it was really, quite successful. We were asked to share our experiences through a book chapter. This one was on opportunities and challenges with student leadership in IPE, a Middle Eastern perspective. Many of our former students of the IPE are now working together. So I saw this picture on our IPEC on my Instagram. And it's Jawahir, a medical student, and she was the IPE Student Association president. And Kauthar was the vice president, and she was from the College of Pharmacy. And they posted this, that now, they've worked together as students for like about 4 years, and now they're working together in the practice. I posted this on my Instagram account. And then one of our alumni wrote back saying, honestly, it's very different when we are now working with the new doctors who were part of the College of Medicine and attended IPE activities. They actually understand and appreciate our roles and sometimes seek us out even when we aren't part of their team. It is so much easier than having to prove yourself and explain your role. So it's really inspiring to witness how their collaboration in the student association has transformed into real-world teamwork. So the most powerful evidence is not data. It's moments where professionals communicate differently, the team behaves differently, and the patient feels safer. And IPE is no longer optional globally. It is becoming a health system requirement. So one of the things that we, as part of Interprofessional.Global, which is the Global Confederation for Interprofessional Education and Collaborative Practice, we noticed that there was no network within our region, the Middle East, the Arab region. So back in 2014, we started thinking, we actually need to think about having a network within the region. And at that time, IPE was growing with different countries, starting to adopt IPE. Then we formed with the group of IPE champions from the region, the Arab Network for Interprofessional Collaboration. So the region is not following the global IPE. We are helping shape it. And we are contributing to this international discussion on interprofessional education and collaborative practice. So we are not teaching teamwork. We are building professionals who expect to work in teams. Healthcare requires professionals who expect to work in teams, understand and respect roles, communicate across discipline, and share accountability for patient outcomes. When collaboration is measured and recognized, it becomes valued. Similar to assessment, if students, if you do not assess, they think it's not valued. So that's why the early indicators of transformation is important, and it matters. Growing faculty ownership of collaborative training, the integration into curricular structure, the alignment with national healthcare priorities, and the increased visibility of collaboration competencies. If you to do only 3 things within your institution, I would encourage you to make your roles visible. Everyone knows who does what and why. Normalize speaking up. Safety depends on psychological safety. So whether you are within educational institution or whether you are practicing. And designing collaboration into the workflow, it's not added, it is embedded. So IPE must move from being a special initiative to being part of the daily routine, from having isolated training to an embedded culture, and from just having some individual champions, IPE champions, to having that institutional commitment for IPE. And I always say to our students, patients do not experience our title, our hierarchies, or our boundaries. They experience the quality of our communication, the strength of our teamwork, and the care we deliver together. So when collaboration is fit for purpose, care becomes safer, smoother, and more humane. And if we go back to Sarah's case early on, if everybody was doing their job well, but she was frustrated because of the lack of communication and the weakness of the teamwork amongst the different professions. The future of healthcare will be team-based by design. If we believe that collaboration is essential for patient safety, it must be structured, it must be developed, it must be tracked, and it must follow professionals across their careers. So I want you to imagine a healthcare system where a doctor expects to plan care with the team, a pharmacist expects to lead clinical decisions discussion, a nurse expects to challenge unsafe prescribing, and a patient no longer experiences healthcare as disconnected, but as one coordinated human experience. At this moment, collaboration is no longer an exception. It's no longer an added skill. It is part of who we are. And I believe the future hiring question, and I see it coming, that show me your collaboration record. It's measured, verified, and portable. So just like nowadays, clinical competency, this is a question we ask. I believe this is going to be the upcoming question, but who leads it? If collaboration is essential for patient safety, then collaboration cannot depend on personality. It cannot depend on luck. It cannot depend on who is in the team. And it cannot depend on somebody who attended maybe a workshop 5 years ago. Collaboration really must be designed, as we have done with the IPE passport. It must be developed, and it must be visible across the entire career. So we start with interprofessional education and continue in the practice with the interprofessional collaboration. The future of healthcare will not belong to the smartest profession. It will belong to the teams who learn how to think, decide, and care together. Collaboration is no longer a soft skill. It's a survival skill for modern healthcare system. And as a concluding point, remember that we are not preparing students for healthcare system as they are. We're preparing them for systems we are building. Thank you so much. Please feel free to connect with me on my email or on my LinkedIn or X account. And yeah, thank you so much for the invitation, and I'm happy to to discuss this topic further with you.
Thank you so much, Dr. Ala Al-Awaisi, because I pronounced your name incorrect at the start, and pardon me. And thank you for sharing this multiple and inspiring experience. I am sure all the audience will contact you or will use some of your ideas for further implementation of IPE. Now we have maximum of 5 minutes for any questions. So if anyone wanted to ask a question, please either share in the chat or feel free to raise your hand. We had only one previous question. Oh, sorry, Dr. Wagdi.
I just would like to thank Dr. Ala for the very interesting talk that she delivered. I listened carefully to all her lecture, and I have an aha moment. And she can correct me if I say it wrong. We don't consider any activity that happens between professionals with the interprofession perspective just because they learn together. They have to learn from each other as a necessity to consider this a true interprofessional education. And also they have to know each other, to know everything about each other and their jobs, how they perform their jobs, and how they can collaborate together for the sake of the patient. Is this true, Dr. Ala?
Absolutely. Like we need to really be able, like we need to understand our roles first, and we need to understand the roles of others to be able to collaborate effectively. So I think like many times, I've seen some professionals who feel less confident about interacting. And then when you come to look into it, you find maybe sometimes they're not confident in their own role. Because all IPE or interprofessional collaboration it's about that willingness to share expertise. So you really need to be confident in your own role to be able to share that expertise together. So we need to have that, and that's one of the most important or critical IPE shared competencies is the roles and responsibility, which is understanding our roles, understanding the role of others, to be able to effectively work with them.
But we can consider that to know exactly your role and the role of the others in the interprofessional practice. But in interprofessional education, say in the undergraduate curricula, does this also apply on the students? Because probably their knowledge about all their roles and the roles of the others is not enough for them to be confident about themselves and the functions that they perform. So should we expect them first with some planning from us to not just to allow them to learn together, but also according to the educational setting, to make them learn from each other some way or another. Is this
Yeah.
a key issue in interprofessional education?
Yes. Yeah.
Is to learn from each other? Yeah.
Yes, it's the learning with, from, and about each other. So you've raised a very important point that, sometimes people feel, well, they need to understand their roles, and, it takes time for them to understand their roles to be able to effectively contribute to the team. But early socialization between the different health profession is very important. And that's why when we develop the IPE activity, we have the exposure, immersion, and mastery level. So at the exposure level, we're not expecting them to have that clinical knowledge per se, but it's about how do we, what is the role of the physician? What is that? Like, for example, we have this patient with diabetes. They've been admitted to the hospital. Who are the professions that is going to deal with them? So it's a simple case, but they start understanding that the patient care doesn't rely on only one person. They start understanding the different professions, my profession. So it's developing that professional identity, and at the same time starting to build that interprofessional identity. Then, so the first couple of years, it's all about the exposure, being able to communicate with each other, understanding roles and responsibility. Then, as they get more into their curriculum, we have the immersion. And this is where the student will start getting some clinical cases. And within this clinical case, let's say, again, it's focused on diabetes. So now they have studied diabetes from their own perspective. Then we give them a case to start to think about coming up with a plan for this patient, and everybody shares what's their input. So the pharmacist will be thinking about it from a medication perspective. The physician will be thinking about the diagnosis and the management, and so on. Then we move to the mastery or the competency level. And here where we have the simulation. And recently we started introducing IPE simulation within our curricula. And actually it was very interesting really to observe that students, when they're doing OSCE, as it's usually one, they are the student, they see the SP, and they do the data gathering, the management, and then the follow-up at the end. But when we put them together, yes, they've been doing the case-based discussion, but now they have a standardized patient, and they are all there. So they had to negotiate the overlap in the role. Like, I had the student telling me, well, you know what? I used to do the data gathering, the management, and the follow-up myself on my own. But now I had other 3 professions. So we had to decide between us who's going to do the data gathering, who's going to do the management, who's going to focus on this particular issue the patient is facing. And it was really a good progression. And now the move then to the IPE placement, where, they've finished with their preclinical years and moving towards the clinical. So I always talk about it's important to have that professional identity, which will develop across different professional year. But then it's also that dual identity of the interprofessional identity that develops alongside their professional identity.
Okay, thank you.
Thank you so much, Dr. Wagdi, for sharing your aha moment, and for Dr. Alef for this detailed response. I don't know if anyone wanted to share an aha moment and follow Dr. Wagdi's approach, or anyone have a question for Dr. Asma or Dr. Alef. I know that someone asked for the IPE framework that Dr. Asma shared at the start. And if it's available and they can have a copy of it. Dr. Asma, do you want to comment on this?
Yes, okay, Dr. Angie, inshallah, it will be available with the record of the session, inshallah, regarding the guide. Okay.
We have
Um,
another question. What do you think is an effective instructional strategy for IPE?
We
Whoever
mentioned
wants
in the
to.
comprehensive guide a lot of strategies can be used, and also Dr. Ala explained a lot of experience and a lot of publication are explaining how to use different strategies for IPE. In the comprehensive guide, we explained the importance of using team-based learnings, IBE-led seminars, different educational campaigns, simulations, different methods. And also, Dr. Ala explained a lot about their trials and what we are using in Faculty of Medicine, South Carolina University, and also different methods we use in Ibn Sina. Same strategies, same activities, but the concept, as we mentioned, we need the student to be familiarize about the concept and how to interact together and to learn from each other and about each other.
Dr. Ala, we have a question for you from Dr. Mona. My question is, how do we implement IBE in large batches of healthcare professional students? I know from where this comes because in Alexandria University, Cairo University, we have a very large
Thousands.
number of students in each batch.
Yes. So for us in Qatar University, usually when we have large number of, or actually the IPE activity, usually there are, large number of students, maybe not as much as Cairo University with 1,000 students per batch. However, usually the best way to do this is you could maybe have for that specific activity, have it over 2 or 3 days, but you need to make sure that you have representations from all the different professions. Now, when we do IPE activity, we also have a facilitator for each group. So you need to ensure that you have enough facilitators for the IPE activities that you are going to be doing. Now, I know in some places when they have a very large number of students, they use the football stadium, for the activity, especially for the first years. But I always say when doing IPE, maybe the first 1 or 2 will be large number of students, but then when you are developing your program, make sure that the activities are, you can have, let's say for third year students, 2 different or 3 different IPE activities, and not all the different profession needs to be part of it. So you can try to develop 2 separate cases of relevance to the different professions that are naturally working within settings. Plan the activities accordingly. Remember, with IPE, it's 2 or more professions. Also, with large number of students, you may want to think about, of course, not for all of the activities, but you can think about online IPE activities where you can have different breakout rooms and students, join one of the rooms with the facilitators. But from our experience, always the face-to-face activity is usually one of the best ways that we, do it, and the students really appreciate it a lot. I saw that there was a question regarding how to join the interprofessional.global, so I'll put the link. But also, if you are interested in being part of the Arab network for interprofessional collaboration, just send me an email, and we will add you to our directory. And if interested, we have several working groups. We have like a capacity building working group, the research working group, and communication. So, you can, let us know if you are interested in any of these working groups to join them and being part of them. We had last October the second Arab Network conference in Saudi Arabia in Abha. And the third one, inshallah, will be taking place in Kuwait. It was meant to happen in November, but because of the situation in the region, it has been postponed to 2027. And also, I wanted to let you know that as part of the Interprofessional.Global, there is the Altogether Better Health Conference, which was hosted in Qatar in 2023. And this was the first time to host this conference. But there is the 12th edition of the conference will take place in Cyprus in June 2027. So this is also an opportunity, for the IPE activist to come present the work that you do and participate in the conference. I will just share the link. I've just shared the link in the chat box.
Thank you so much, Dr. Ala, and thank you all audience for your presence today. I wish you a good night, and thanks Professor Asma for the comprehensive presentation. Thanks Professor Wagdi for joining us in this session. Hopefully this will be the first session in the collaboration, but I'm sure we'll have many other sessions in this collaboration between the two networks. Okay, thank you so much. And now the session is concluded.
Thank you so much.
Doctor.
Thank you.
Thank you.
Assalamu alaikum.
Wa alaikum
Wa alaikum salam.